bagus sekali acara ini. Semoga tahun depan ada lagi, karena tahun lalu ada dan tahun ini alhamdulillah dilaksanakan lagi, dan hari ini saya bertemu langsung dengan dokter dan sebentar lagi saya akan diperiksa afisan saya. Semoga baik-baik saja afisan saya. Ya.
Ada program kita cek aviation gratis ini juga sangat membantu. Dimana kalau kita cek itu kalau nggak salah biayanya cukup mahal. Jadi gratis itu sudah luar biasa banget. Jadi kalau bisa ya diadain lebih rutin gitu. Jadi pasien lebih komplit, kompak gitu.
Gitu kalau bisa sih.
Halo. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good evening, everyone. How are you guys? Halo Gerhana.
Ya, selamat malam dokter.
Halo. Okay, is it already complete?
Not yet, sir, but you
Okay.
can start.
Yeah.
Right away.
Okay, for the blue groups, you may prepare, please. Thank you. Who's going to start for the blue group?
Excuse me, sir. Can I be the co-host so I can
Oh yeah,
share screen?
yes. Yes, yes, no.
Oh, did we start now?
Permisi, Dokter Niko. Suara dokter masih mute, ya.
Please do.
Apakah bisa dimulai, dokter?
Silakan. Boleh.
Okay.
Silakan, Mutia.
Bismillahirrahmanirrahim. A 38-year-old woman presented 6 months postpartum from the birth of the third child with pruritic bluish veins and a burning sensation behind her knees. She was embarrassed to wear skirts and dresses. On physical examination, she was obese and had prominent reticular veins behind her knees and along her lateral lower thighs. A 58-year-old woman presented with several years of painful bulging leg veins. An intensive care nurse, she noted heaviness and aching pain that was worse at the end of the shift. On physical examination, she has large rope-like varicose veins along the right lower leg and left thigh. So these are 2 cases of varicose veins. See how they feel so uncomfortable and yet unconfident, and yet they still didn't know their disease until it becomes severe. Varicose veins are part of the spectrum of chronic venous disease and include spiral telangiectasis, reticular veins, and true varicosities. Approximately 20% of US adults have varicose veins. If spiders, telangiectasis, and reticular veins are also considered, the prevalence increased to 80% of men and 85% of women. Generally, more common in women and older adults. Varicose veins affect 22 million women and 11 million men between the ages of 40 to 80 years. Of these 2 million women and women will develop symptoms and signs of chronic venous insufficiency, including venous ulcerations. The sheer prevalence of varicose veins and the substantial cost of treating late complications such as chronic venous ulcers contribute to a high burden on healthcare resources. Chronic venous and cost estimate $3 billion per year to treat in the United States. Even varicose veins alone without more advanced signs of chronic venous insufficiency result in important reductions in the quality of life. So, Assalamualaikum warahmatullahi wabarakatuh. Good night, everyone. Today, we are a blue team. We would like to present Varises Indonesia to solve all the problems that I already mentioned. So, meet our team. My name is Mutia Nabilanur Afra, and I'll be your presenter tonight. And the other member team is Akidah Hariri, Dewan Selasati Buana, Diska Hanifah, Femi Titania Fahira, Pugu Octavian, and Zafiria Loka. And also Grahana Ade as a captain. So next, for Zafiria, it's your time.
Okay, varicose veins are enlargement or dilatation of veins caused by a buildup of blood. This disease most commonly affect the lower limbs. Varicose veins are more common in women than men. Obesity, pregnancy, and old age increase the risk. Initially, the disease is asymptomatic, but over time, the pain will appear. Okay, next.
Thank you. So next, for Akidah Hariri, it's your time.
Thank you, Mutia. For the next, we are going to additional examination that can be used to diagnose the varicose vein. The first is Trendelenburg test. The Trendelenburg test can be used to evaluate the venous system and assess the severity of varicose vein. It is usually called tourniquet test because it uses tourniquet. But for nowadays, it is rarely used, especially when the Doppler ultrasound is available. And then the second is Doppler ultrasound. It is now the gold standard and the first diagnostic test to assess varicose veins. It can assess venous obstruction, turbulence, and the direction of venous blood flow. And then the third is varismography. This is a non-invasive test that can measure and record variations in volume and pressure as the blood flows through tissues. This test is used for patients who severe advanced stage of varicose vein. Then the fourth is CT scan and MRI. These are not indicated for patients who present with simple varicose veins because Doppler ultrasound is usually sufficient to find obstruction or vein abnormalities. However, CT scan and MRI can be helpful in identifying obstruction in the pelvic or iliac vein system when proximal obstruction is suspected. And then here are the treatments that can be given to the patient which have varicose vein, whether it is for prevention or symptom. The first is stocking compression. It is the most simple treatment that can improve circulation, stop varicose vein from getting worse, and reduce pain or discomfort. It is also performed as a complement and prevention of recurrence after surgical and drug therapy. Then the second is sclerotherapy. Basically, it is done by injecting a certain solution that can later expected to destroy the affected vein. It needs expertise skill and not anyone can perform this treatment. And then the third is open surgery. One of the methods is saphenectomy, in which the problem vein is tied and then symptoms and also avoid recurrence. But this is rarely used nowadays because there is endovenous ablation therapy. And then the endovenous ablation therapy itself is a method that uses a wire that is inserted into the vein through ultrasound assistance. Then a kind of tube that carries a laser machine or a small radio frequency is inserted along the wire. Then the heat will be transmitted and eventually collapse the vein that dilate and slowly. And here are some complications that can happen when the varicose vein is not well treated. They are bleeding, blood clots, infection of blood vessels or thrombophlebitis, and disturbance of venous flow or chronic vein insufficiency. Here are some messages that can be noted. First, position the feet higher than the body. Use compression stocking, adjust the condition of the body weight. For example, if the patient is obese, so try to manage the body weight by reducing it from managing the diet or maybe by physical activities. And then avoid alcohol consumption, wearing clothes that are tight on the stomach, such as tight belt, and don't cross the patient's leg when sitting. Increase the physical activity, and if the patient have some daily activities that require the patient to stay in a certain position for a very long period, try to take a rest every hour to just stand up or walk a little to help the venous return. Thank you.
Thank you. So next, Pugu, it's your time.
Okay, like what has been explained previously, that these diseases are the vein, dilate, and twice. Because the disease not popular as diabetes or chronic kidney failure, we cannot find the number of sufferers of this disease. Like in Ministry Health report in Riskesdas, we cannot find this. However, the prevalence of this disease is variable. In women is 100%, 1% until 73%. Then in men is 2% until 56%. To prevent this disease, we can reduce the risk factor like older age, female, family history, obesity, and occupation. Especially the risk factor can be controlled like obesity and occupation. Okay.
Okay, thank you. So next, Femi, it's your time.
Okay, introduction about Varises Indonesia. The definition is as a health service application in dealing with varicose veins. And for the founder is Dr. Niko Azhari Hidayat, cardiothoracic surgeon consultant, Fellows Indonesian Heart Association. And this application starts on Saturday, the 25th of November, 2017. This application available for Android and App Store. Okay, thank you.
Thank you. So next, Diska.
So what are the features of Varises Indonesia application? The first is it provides education about varicose veins. This feature gives essential knowledge about varicose veins for users, such as signs and symptoms, physical and sporting examinations, how to treat varicose veins, and complications that progress from this disease. And the second is news and articles. Yes, it informs the users about the latest news and events and also advices from Vascular Indonesia. The information includes varicose clinic at Airlangga University Hospital, varicose awareness day, webinars and health tips, and etc. And the third is, next, the gallery for additional information. This section stores photos about varicose veins. As you can see in the screen, there are many photos about varicose veins and events and maybe some articles about varicose veins. And the fourth is you can consult with doctors. With this feature, users can consult their symptoms or maybe send questions or discuss something related to varicose veins for free. Then users will get the best and evidence-based answers from doctors. Thank you.
Thank you very much. So next, Dewan, it's your time.
All right, thank you, Matia. So here I am, I'm going to explain about what's on the apps and how to use it. You can go next. So the first one, we have to get the apps. So we can get the apps by the App Store or the Play Store. Here's some link. And then you can also access it by the website, as my friend explained before. And then we go next. This is some video that I made. This is a raw video. You can choose your OS app provider and then go to search. And then you can type vascular or varices Indonesia. You'll find it on the yes. You can tap download and open it because I already downloaded, so I can also directly open here by your browser if you want to access the website. Also, just type Varises Indonesia and you can find the website. Yeah, just like that. It's very simple. I think my grandma can do that. All right, we open the app and then jump to the home section. We tap the menu. The menu is the one in the upper corner left that have 4 strip line. You can tap that. And then we will find, here we go. Home, about us, about varices, about news and articles, about the gallery, consultation, and also how to contact the Varices Indonesia. This is some preview of the apps. This is already explained by my friend before. This is exactly the same with the website, but you can access this easily with your phone. And then here we go. The contact us and the consultation. The most important part is the consultation. Now, this is very simple. You can just first take a picture of your part of body which have a varices, and then you can upload the file, upload the pictures, and then you fill up the name, you fill up your email and also your phone number. And then on the down, you can state your problems. What's problem you have? What problem that very unsatisfied? Yeah. And then you go next. Just like that, and you can send your consultation directly to the specialist.
Okay, thank you, Dewan.
You're welcome.
These are the advantages of Varices Indonesia. First, help varicose veins patients to find information if they seek to know whether they have varicose veins or not. So my friends already mentioned that there are so many features of Varices Indonesia that help people, such as education for patients to know more about their disease, and news and articles for patients, tip and trick, talk with the experts, varicose vein checkup, and etc. Second, platform for varicose veins patients and experts. It will also help them to seek the best experts that can help them and share the symptoms and get support from the experts. So next for the SWOT, I would like to ask Femi and Dewan to join us. Femi, can you tell us about what did you think for the SWOT of this app?
Okay, for SWOT, first strength, make it easier for people to communicate directly with the Varices Indonesia team of doctors. And this application can be downloaded for free on the Play Store. And for weaknesses, limited specialist doctors, opportunity, smartphone users are growing rapidly. There are still few websites that discuss details about varicose vein. And the last threats, as technology develops, the emergence of many competitors. That's all.
Thank you, Femi. So Dewan, what do you think about the SWOT of these apps?
All right, for the strength, this application, this Varices Indonesia, is very easy to access, very easy to use, and also less time consuming. and you can consult your problem anywhere. And then the weakness is, I don't know how many doctors, how many specialists is joined in the Varises Indonesia. So I think it's very limited specialist doctors. And also, this app is new, the branding is insufficient, and also, well, I said also too many times. If I am a patient and then I don't know what kind of treatments, what can I get as a patient that's different with other med applications and also beneficial for me. Let's say I have varices, I can consult to maybe HaloDoc. They can also cover the varices, I think. So what's difference and what's the special one from these apps? That's I find not yet. That I didn't find it yet. Okay. And then the opportunity is this is an app that's specially made for varices. That's the opportunity because mostly the medical apps is it's for general practitioner, the wide range of medical problems. And also the threat is because this is a very specific app that's also a very small range of patients. And because that small range of patient, this is very easily to be conquered by medical startup. Yeah, I think that's so.
Okay, thank you, Dewan. So that's all our presentations. If you have any question, let us know. And thank you very much for your attention. And wassalamualaikum warahmatullahi wabarakatuh.
Yes, Waalaikumsalam warahmatullahi wabarakatuh. Very nice, guys. Very impressive presentation. Good for you guys. Yeah. Well, I should clap for you for that. And yes, okay. I will try to answer a little bit about the weakness, because I always interested on the weakness, not only the advantage or the positive sides. Okay, let's check this website out. I will first open the Allo. Sorry, this Allo Doctor. Oh yeah, this page. This is Allo Doctor. This is Allo Doctor. I browse varices. Allo Doctor tells about varices in, of course, it's in Indonesia. Of course, like just exactly the same, and that's it. It's all about, I think, like 500 or 300 words only, and it is by Dr. Chin Willy. It's a GP. I know him actually, and it is quite superficial. Let's check out the symptom signs and the treatment. Yes, this is like only words. It's not specifically tells and what the clue after the patient read this. And this is the HaloDoc. HaloDoc, it is from the varices symptoms, complications, when to go, and what I'm trying to say is that in their platforms, it seems a bit of superficial, and the difference between the Varises Indonesia, yes, of course, Varises Indonesia a little go deeper and specialist, and we have our differences on the way we transfer the knowledge since we are having 4 functions per role, first is informations, the second one is educations, the third one is communications, and the fourth is consultations. It's like it is a teleconsultation for specialists dedicated for a specific disease, right? And that is actually perhaps the difference. And limited specialists, yes, because my colleagues in cardiothoracic and vascular surgery doctors is like about 150 to 200 surgeons, cardiothoracic vascular surgeon. But don't forget that dealing varicose vein is also dermatology and also cardiology, and perhaps some of the area also still general surgeons. And for sclerotherapy or compression, there is also a GP. So if we understand the level or the stadium of the varicose vein, actually it is a quite large doctors who handle this varicose veins disease. So if we, as a startup runner, to increase the role of the doctors, I think it might be possible that many of doctors can treat varices in a different level. Like I give example, just like perhaps like Gojek, some of the driver driving cars, some of the driver riding motorbike, some of the driver send food, some of the driver only send or drive people, right? So I think it still can be improved in the number of the doctors who is involved, right? That's why I create few is Varises Indonesia educational webinar. After doing the few project, it is the 4th module. First is clinical aspect of varices, clinical findings. The second one is medical compressions skills. The third is sclerotherapy injection, suntik varices. The fourth is basic varices ultrasound. If a doctor who has already hold these 4 skills, they can be the Varises Indonesia leader. And don't forget GP, thousands of GP can be the runner of this Varises Indonesia leader. And they can share their role to the consultant who is dealing with endovenous laser ablations, right, to do the ultrasound in this hospital. So I think that is the strategy. Okay, until this line, is there any question or opinions? I like the way you create the animations, yeah, to describe how to open the apps. Yeah, that's really cool. And that is actually creativity that I appreciate. Okay, is there any question or suggestion or opinion or inputs? Everything? I actually haven't remember. There is Dewan. Dewan, I just know. Dewan rarely shown up your camera, perhaps. or you're just a shy guy, shy person, or you might be a busy person maybe.
No, sir, I'm just shy guy mungkin.
Oh yeah, okay, that's okay. I was a shy guy. I was a shy guy, but uh, put in your mind that shy is not helpful in your near future. I mean, it's okay, it's okay to be shy, but you have to be confident. Like what I said, right? Confidence should be the middle name of you. And for the blue groups, maybe some of things are missed, and I think I need to show you. I need to show you because this actually quite interesting. Varises Indonesia was actually I already put in the exhibition long time ago and earlier, even rather than Aviation Indonesia and Kaki Diabet. I put them first rather than the other one. And Varises Indonesia, this is a year ago. Varises Indonesia has already let me prepare this video first for you, so that you can Indonesia. So, just wait. No, this one. Okay. No. This one, okay. This one, okay. This is May 2020. The other first one is okay. Oh. Okay. Varises Indonesia is actually had its ambassador, and its ambassador is a Miss Miss Indonesia. Is Java. Can you hear the sound?
Dukungan ini diberikan agar
Yes,
Putri
Dok.
Indonesia terpilih
Okay.
dapat memberikan pengetahuan dan pemahaman kepada masyarakat bahayanya penyakit varises. Penyakit satu ini memang terbilang sepele, namun jika tidak diobati dapat membuat sakit pada kaki. Penyakit varises kini tak hanya menyerang kaum pria, namun juga kerap dialami oleh perempuan. Dukung Varises Indonesia sendiri diberikan dalam bentuk pemberian pemahaman lewat pemaparan materi yang langsung diberikan oleh Dr. Niko Azari Hidayat pada waktu masa karantina Putri Indonesia Jawa Timur. Selama 2 hari, para finalis Putri Indonesia Jawa Timur diberikan pemahaman mengenai bahayanya penyakit varises.
Varises Indonesia tahun ini adalah kali kedua mendukung acara Putri Indonesia pemilihan, ya, karantinanya dan juga grand finalnya malam ini. Basis pemikirannya adalah di mana wanita Indonesia sekarang harus menjaga kesehatannya, tentunya kecantikannya, dan juga update terhadap teknologi. Oleh karena itu Varises Indonesia Media Komunikasi Aplikasi Kesehatan masuk atau bergabung di dalam Putri Indonesia, di mana mereka juga harus memahami bahwa teknologi kesehatan itu sekarang ini di masyarakat juga sangat diperlukan. Kira-kira begitu.
Kenapa harus memilih yang usia seperti ini?
Nah, ya, Varises Indonesia mempoinkan untuk usia muda, tuh khususnya untuk para finalis atau putri Indonesia ini, karena mereka akan menjadi leader gitu. Jadi mereka akan menjadi poin yang penting untuk memberikan pesan atau message kepada masyarakat. Jadi masyarakat akan mendengarkan apa kata mereka, akan mendapatkan informasi dari mereka, sehingga masyarakat lebih kena gitu ya, artinya informasi itu disampaikan.
Varises Indonesia sendiri berharap terpilihnya Duta Putri Indonesia Jawa Timur kali ini mampu mengkampanyekan pemahaman dan bahaya penyakit varises di masyarakat.
Ya, seru ya. Iya, oke. The other movie is in 2020 before pandemic. Yeah. Yeah. Jadi, yes. So the idea to bring this to happen is that if you have ideas and then you put ideas and ideas together, it's connected, yeah. And I brought the trilogy, beauty, health, and technology, because health started with Varises Indonesia, and then we need a leader to speak about varicose veins. And yes, that is actually the idea. Okay, is there any opinion or suggestion from you guys? Can I take?
Doctor, maybe I have a question. Yes, I'm curious about the consultation feature. So how long it takes for the patients to get their answers from the specialist, and where will the answer be sent at their emails or maybe in the application itself? Thank you.
Doctor, you're still on mute.
Okay. Okay, let's try to do this now. I will show you. Where's the? Sorry. I will try to show Google Chrome. Now, okay. Let's open from this chamber. This. Okay. I will open from this. Yeah. Sorry. I will open the Varises Indonesia. Of course, Varises Indonesia. Varises Indonesia. Okay. Now, I will try to consult DG. Let me just put like Nico as add gmail.com. Hey, I ask some varicose problem. Can I attach? Browse. Browse. I will try to put some pictures from here. Maybe this one is okay. Bottles. Okay, I will submit. No, Nicholas Hidayat, Gmail. Okay. Here. Okay, it's sent. Okay. Okay, now I will open to stop share. I will open to open it to the this one. Okay, yes. I will open this. I'll open on VARISES Indonesia. Just watch, guys. Yeah, I will new consult. This one. Yeah. Open. I will check on my website. Okay. This is the dashboard. This is the dashboard. And this is the dashboard, and I will see the consultations. I have some varicose problems. Then we can see. And then what we are going to do is we answer varices Indonesia solusi. Dear Nico, I am answer you. Okay. Select doctors. Nico. Send. Okay. Now we are going to check. You can check this on this thing on this one. Which is this is Nico. This is Nico. They reply. Yeah. Understand now? And for
Yes.
you guys to know that that's why we are fully understand on medical terms. Since we are since we are a medical person, we know varicose veins is what kind of disease. It is not an acute disease, right? It's chronic disease. So even when this patient sending us on emails, and then we are going to check it tomorrow or the day after tomorrow, it's okay, right? That's actually the idea. It will not need for us to urgent action, right? That's why email platform should be fine. email platform should be fine. Even in apps or in Android, you can find this phone number and then also WhatsApp. You can go through directly on my phone, but it's quite rare. But email is fine, right? So that's why we have to understand that select the disease complaint or disease focusing is a bit important, right? So yes, thank you. Yeah, the collaboration with uh, uh, the ambassador, I think you can also think that as well. If you think that a doctor telling things about varices disease, varicose vein disease to patient is normal. It's usual, right? But if one leader, key leader, yeah, that is young, that is also a key speaker, I mean keynote speaker, or maybe is a role model, I think it's better. That's why I try to collaborate between to many important persons. So yeah, okay. This guy, it's already answered now.
Yes, sir. Thank you.
Yeah, that's actually the apps will do. And also it's exactly the same with Aviation Indonesia. I haven't shown you the dashboard. It's actually quite the same. Okay, now, okay, is there any question?
Me, sir.
Yes, please.
Well, I just curious how many doctors that joined this platform, and did they get paid? And did the patients need to pay the consultations like the other platform? I mean, in this platform, the expert is specialist, not general practitioners, so it might be they need to be paid, I guess.
Well, since I am medical doctors, and we are medical doctors, we are not actually in a proper way to think how much we will be paid, right? It seems like it is something that quite odd or absurd. That is what I'm thinking. That's why until now the consultation is never been with any prices. The simple thought is that our people, we encourage them to go to doctors for free. It is not so easy. How can we tell them to go to consult, the daily consultation with paid registration and everything? Our people is not going to choose this method. That's why I still think that I might not to collect their money only for registrations, only for small discussion or talks. So I still prefer patients to be able to share without any doubt, right? So that they can ask freely, yeah. But if you see this one, I will show you again. The consultation is actually quite high. See this. This is so cool. This is so actually so many. This is what we call traction. So people notice us. People notice Varises Indonesia. That's why when they want type in the Google, who's comes up? Varises Indonesia. That's relieving for us. That's relieving. That's make us happy because our brand noticed by many people. And of course, I don't expect for many people, millions of people, no, download this apps. No, because usually varicose veins people, patients, after they are solved, they will uninstall. So it's not something like we have put Gojek in our Android or App Store or on our mobile phone. So that's okay. That's only the different side of apps. Okay, is there any other suggestion? Or Nadif, what do you think about this crazy apps?
Yeah, I think it's beneficial for people with varices disease.
Yeah.
And I'm just wondering about what you said earlier, because all of your apps is for chronic disease like kaki diabetes and
Yes.
Aphasia Indonesia, Varices Indonesia. And I'm just wondering maybe if you ever think about for acute disease or maybe some kind of injury.
Right.
How about that?
Right,
Thank you.
right. That's really, really critical questions. I don't think I'm going there because I still hold these apps as one of the tools to telemedicine, telehealth. One of the key to do the telehealth is not doing the acute one, not the injured emergency one, because telemedicine would not be sufficient. But of course, as an education, I create one platform, and it is also since I know this this surgeon from Harapan Kita Hospital, and he loved photography, and he loved as well this organ, so I offer him, and then boom, we have this one. It is aorta. Aorta is quite frightening, yeah. Aorta Indonesia, but of course it's in the level of informations, telling what is it about, right? And try to make people understand what part of aorta that kill. Because if aortic rupture should be fast, don't wait for minutes, it's like seconds, right? So that's why I create this aorta Indonesia only to share awareness. There is no disease more conducive to clinical humility than aneurysm of aorta, William Sir Osler. This aortic, and I'm a I'm a huge fan of web design, so I choose this reddish color, like a bloody arterial blood, yeah. And then I try to make this because it's aorta, and then this Diki Alighieri Bartone is a photographer. I just create this autographer term that is, I don't know if it exists or not before, but I just write it down. So yeah, it is fun, guys. If we try to create and then create like this one, if we trying to create this feature on websites, we have to think inside of the aorta. In the aorta, there is always pulse because it's artery, right? It's a big artery. This should be pulse. If we're speaking of about veins like varices, we don't think about pulse. Since this is aorta, pulse is so dominant. And don't forget aorta is there is an intima. There is a tunica in media, tunica adventitia, and then of course pressure. So that's why I like to concept. That's why if somebody asks about who you are, I'm the founder and conceptor. We are always happy to be mentioned as a conceptor because concepting things, it's a higher things to do. Aortic gallery, open aortic surgery, aorta for vascular surgeons. So it is like a gallery. It is so fit for him. This is our taking inspirations, amazing aorta, songs from aorta. I think I also have this learn from my sensei or something since because he was studied from Korea. Aortic sense from the sensei. I like to play words. Aortic sense from the sensei. So yeah, you will enjoy things if you really like to explore. And corona, aorta, the two dangerous, corona and aorta. Yeah, so this is the real pictures. This is the real. I mean the real. Dr. Tiki Aligaris picture. So on your heart. So yeah, that is one I can share about the other disease that I also create. It's not acute actually, but yeah, we should try some things that we can run, we can achieve. If we are not sure, I don't think we should go. I mean, acute. What is acute? Heart attack maybe. When I was in accelerator program with Indonesian Swiss accelerator program, I have this one competitor from Bali. He have like a knob, like I think like this size, this side, it's smaller. It's a knob. When geriatric patients fell down, he will hit the knob and then emergency call. But it's something like device only, like you don't go for a specific disease, but they try to help for the older people if they are alone in the house. So, and but actually, I try to build one more, and it is related to stroke. Actually, if you say something about the acute, since because vascular is also cardiovascular, peripheral vascular, vein, artery, kaki diabetes also peripheral. Affections also related to neurovascular. I try to create, but I have to contact my friend, my fellow from neurology, so that I can collaborate with them. But the funny thing is that I'm not yet convinced what will be the name. Is it Carotis Indonesia or is it Stroke Indonesia? Because it's so neurology, of course. I want more on vascular side actually. On vascular side, it should be carotid, but not so many people know about carotids, right? So that's not it. We should think about what our people might think. Varices, many people know, right? Kaki diabetes, many people know. That's why I give the name kaki diabetes, not kaki diabetic, not kaki diabetes. It's really precise putting names by me because it is easier to kamu diabetes, ya kamu diabetes, no, saya diabetes Pak, ya kaki diabetes. Kenapa saya nggak bilang lukadiabetes.com gitu? Saya mau klien atau marketnya lebih luas dari, ngerti ya? If we want the bigger market, the bigger society, it means that if you say that kaki diabetes Indonesia, it will conquer the healthy food and also the problematic food, right? But we can conquer the diabetic populations. We can share this knowledge to diabetic population. Hey, people with diabetic, you have to prevent one of the complication, diabetic food. Even you are not yet getting your wound. You understand? Yeah. That is actually how we think. Don't only expect like luka, ahli luka. Oh, I don't want to go there. I want to be the examiner. I want to do the ultrasounds, right? I want to do the endovascular. I want to do the wound treatment. I want to do the compressions. And not to forget, kaki diabetes Indonesia. Maybe this is also the clue for the yellow group next week. I have communicate and working together with one technological unit from ITS. You know that maybe you already heard about 3D platform, 3D printing. 3D printing. If kaki diabetes Indonesia and also me as a surgeon have some patient that already amputation, right? And if the amputation, there is a amputate of the foot, they can measure with 3D measurement, and then they can create the foot by 3D printing. That's why I call it kaki diabetes, kaki 3D Pro, kaki 3D Pro. That is actually from 3D print measurement into the production of the prosthesis. You know the prosthesis of the foot. Like I give you the brand name from United States of Autobox. It's 80 million. It's very damn expensive. But if we can create for our people, like we only give like 2 millions, it's really helpful for them, right? It's really helpful. That's why we have to think, to help, to create, to preserve, to be creative. And when I was in Switzerland, I met this guy from Italy, but he stayed on Switzerland. He built a platform, he called it Swiss Limbs. And he created this very good quality of prosthesis, foot prosthesis. And I think Indonesia should go there for sure. So that's why I'm telling you guys that Varises Indonesia, Avesan Indonesia is not going to be stay there. It's going to develop like this kaki diabetes, like medical compression socks by Varises. Perhaps there is in Waru or Tanggul Angin create home production socks. We can collect them, right? We can ask them to create, and then we can sell for our people who needs socks or stockings or medical compressions. That's actually helping the OKM. That's why I'm telling you that it's not going to stop. it's still going to build and rebuild and rebuild. So it's not going to stop on only teleconsultation. That's all. No. I also interested to blend this artificial intelligence to these three platform. Since what? Since diabetic foot, there is a Wagner stage, right? Wagner 1, 2, 3, and then this machine learning read about, and then they can figure, okay, diabetic foot, Wagner 3, varices is also spider vein. If this machine learning read about this is spider veins, so we make our platform smarter. There is actually also one goal to improve and improve and improve again. Okay, yes. So, what do you think? Is there any other suggestion or maybe idea? Yeah. Okay. Yes. I like to do this method. I mean, share to you, and then you share, and then you analyze, and then you just share what you've got from internets, from information you have. Okay, Grahana, maybe. Is there any question?
I have a question, Doc.
Yes, please.
Maybe it has correlation with discussed question earlier. If you don't mind, may I ask in Indonesian?
Oke, boleh lah.
Baiklah, dokter. Saya ingin bertanya, apakah dokter spesialis yang berkontribusi ke dalam aplikasi Varises Indonesia ini memiliki jadwal kerja tetap atau berupa shift bagi mereka untuk menjawab konsultasi yang ada nih, dokter?
Ya.
Terima kasih.
Terima kasih. Jadi memang ya, jadi 3 tahun ini saya kerjakan, saya garap ini ya, Varises Indonesia, dan ketiganya itu memang karena ini saya buat dengan tangan saya, dengan pemikiran saya sendiri, dan saya belum punya tenaga yang luas, yang banyak. Jadi saya memang belum jadi gini, prinsipnya kalau sebuah apps itu ya, itu ada warehouse besar, tenaganya itu banyak di situ. Kayak baju semua, Varises Indonesia, itu sebagian ya. Mereka akan create artikel, post, create artikel post, kemudian ada konsultasi dijawab gitu. Ini belum, saya belum seperti itu. Tapi ini dalam rangka, jadi ada tahapnya memang 2017, 18, tahapnya ini untuk tractioning dulu, menunjukkan dulu, showing dulu. Nah, asalkan nanti lewat tahun kelima saja, sustain, kita bertahan di situ. Ya, tapi tentu saya harus melihat. Jadi terus terang saya Varises Indonesia ini saya jadikan sebagai satu yang saya persiapkan paling akhir. Maksud paling akhir adalah yang saya jalankan dulu, maju dulu itu yang Avision, karena memang dibutuhannya agak duluan. Kemudian kaki diabetes juga. Dan sekarang lagi dalam proses untuk mengkolek relasi. Misalnya kaki diabetes Indonesia. Ternyata kaki diabetes Indonesia ketika datangnya pandemi, ternyata kepikiran untuk home care kaki diabetes, dan itu berjalan tuh teman-teman perawat kita di Rumah Sakit Universitas Erlangga itu banyak pasien yang nggak mau datang perawatan, akhirnya di rumah. Nah, akhirnya saya buat pivotalnya adalah kaki diabetes Indonesia Home Care, dan itu ada yang handle teman dari perawat di Rumah Sakit Erlangga. Bahkan tidak harus murni dokter, karena jangan lupa kita punya kolega-kolega relasi yang memang tidak harus eksklusif dokter. Nah, apalagi kalau kemudian ada dokter sejawat dokter yang kita bisa train, ya kan, bisa latih untuk perawatan luka gitu, dan mereka kemudian akan committed untuk one treatment diabetik gitu. Jadi kalau jam sebenarnya itu tadi, kalau jam karena penyakit ini bukan penyakit yang emergensi, tidak harus jam-jaman, ini elektif sifatnya. Ya. Nah, ketika nanti ada beberapa banyak, mungkin lebih dari 10, baru nanti saya akan mulai kepikiran untuk tetapkan jadwal. Misalnya apa? Senin siapa? Mungkin kalau masih sedikit ya, Senin siapa? Selasa siapa? Rabu siapa? Gitu. Jadi seperti itu. Dan mengingat juga karena apa? Teleconsultation itu masih belum terlalu kita bisa jalan karena di aturan telemedicine surat edaran surat edaran menteri dibolehin karena pandemi. Tapi surat perkonsil harus ditautkan di Fasyankes, fasilitas kesehatan. Jadi memang harus ada syarat-syarat yang memang untuk mengamankan pasien safety. Jadi memang secara ideal memang harus ditautkan dengan rumah sakit atau klinik, itu pas gitu. Jadi kalau kita mau jalanin itu, ya memang kita harus datangi klinik atau rumah sakit tempat dokter itu bekerja, di-on-kan itu ketika jam praktek. Nah, itu pas itu. Karena nanti ketika diskusi konsultasi, diskusinya itu kemudian akan jadi rekam medis. Itu harus. Jadi nggak bisa kemudian diskusi itu hilang, menguap gitu aja nggak. Itu jadi rekam medis dari layanan kesehatan itu. Nah, itu lengkap itu. Dan itu yang diterima oleh peraturan perundang-undangan seperti itu. Ngerti ya? Oke. Ada lagi? Buku. Ada pertanyaan, Bu. Kok ada benda-benda yang terbangun di belakangmu, Bu? Oh, bukan jendela itu ya?
Okay, doctor.
Yeah.
I have a
question. Good. What question?
With easily to consultation, how system can prevent spamming inbox?
Oh, okay. Spamming inbox. Well, the key, the most important key is that you choose the most secure platform. If you are with the best secure platform, or maybe the flopper, you won't get any spam inbox message or anything. I have never get the spam inbox, so I'm okay, I'm fine. But that's good question. Do you often get the spam inbox, Pugu?
No, because previously I see no like chapter to confirm that send to email is
Yeah. You haven't seen any captcha your robot or not, in the platform,
Yes.
Yeah. We don't need that routinely, but I think it's okay. It's safe. And if I can show you something, okay, no. This is actually one of the difference between websites that secure or insecure. Okay, look, this website, locked, secure. Yeah, Varises, locked. But this website, not secure. Right? Understand? So you have to be very careful on creating websites. And one of the indication is the security of the platform you choose. Now, okay, is there any idea? Maybe you are trying to create some things, or maybe you can prepare on for December 1, or maybe you have an idea, other idea.
Excuse me, doctor.
Yes.
I ask again.
Yes, please. Okay.
Why?
Why?
We choose email to consultation daripada
instead of
chat in application like Grab or Gojek.
Yeah.
Is lebih mudah.
It's easier. It will be easier. You think? Yes. Yeah. Yes. Okay, that is very good effort from you. Can you open the apps, please? No. Can you open? Can you open if you can open this, and you can see when tentang kami, about us. Yeah, tentang us, about kami, tentang us, tentang kami, about us. If you type this 1, 2, 3, this is email, right, Pugu? This is calling. This is WhatsApp. This is directly WhatsApp, right? Press the WhatsApp button. Press the WhatsApp button and say something.
Sorry, doctor. The application is force stop.
Oh, force stop.
Yeah.
Yes, me too, doctor.
Okay, let me try. Oh, okay. It's maybe okay. What about email? Oh, email is it can't. It may be already updated. But email is available. But for only WhatsApp and calling, your calling is not able. So that's why I need a team to check it every day. This is actually the apps. It should be like this, but we have already checked by email. It's fine. So that's why I will contact the developer. If you press this WhatsApp, actually, it's going to be directly on my phone. So in the WhatsApp, chat platform, I think WhatsApp is still the best. That's why I put it on the apps. And then usually when I text the developer and I say that, hey, the WhatsApp feature is not working, and then they go for check, and not more than 30 minutes is becoming back better. So yes. So it's there, chat feature. Yeah, Pogo.
Thank you, doctor.
Yeah. Okay. Thanks for the question. Okay. Now, tomorrow there will be Dr. Gregorius Bimantoro. Dr. Gregoris Bimantoro is the chairman of the Asosiasi Health Tech Indonesia or healthtech.id. Tomorrow he will share about how is the health tech startup status in Indonesia. He will describe many things about the startup in Indonesia, different platform. He also the founder of and the CEO of ProSehat. So tomorrow you will meet him and you can ask him many questions, and I think you can learn a lot from him because he is also one person that since he was a medical student already committed to digital health. So and he already give us schedule at 11 a.m. 11 a.m. tomorrow. 11. Okay. Is there any last question, or maybe somebody wrap up this our meeting today? Maybe Grahana?
Saya ingin
Boleh.
konfirmasi dokter untuk jadwal yang robotik dan drone itu di jadwal sebelumnya itu terjadwal tanggal 24, tapi kemarin tanggal 18 dokter bilang di reschedule jadi tanggal 26, itu benar ya dokter ya?
Betul. Saya cek lagi, namanya siapa? Aldo.
Dokter Aldo.
Iya, bukan dokter. Dia adalah dari teknologi. Dia sarjana teknologi, dia S2 mungkin S3 juga di UK. Tanggal 26. Iya, 26, betul. 26 jamnya. Belum tahu.
Besok hanya kuliah dari Dr. Gregorius dari Health Tech.
Iya, Dr. Gregoris Bimantoro. Sama nanti kalau Sanu ya saya kasih boleh. Ya. Jadi kita besok belajar tentang organisasi health tech dan juga mungkin tipe-tipe health tech.
Terima kasih dokter.
Ya. Oke. Ada lagi pertanyaan? Cukup? Ya, mudah-mudahan kalian benefit dapat sesuatu insight hari ini dan tetap inovatif, berpikir untuk produksi, menciptakan sesuatu. Jangan khawatir bikin sesuatu itu nggak pas dulu, nggak masalah, karena nanti ada hari besok yang kamu akan perbaiki itu. Ya, lebih baik memang kebikin langsung bagus gitu ya, cuman nggak selalu gitu, tapi bikinlah selalu coret-coretan, ya, selalu bikin sesuatu untuk yang bisa kamu tinggalkan juga nanti kan, kamu share gitu, berbagi itu. Ya, kira-kira gitu teman-teman. Ya, terima kasih banyak atas perhatiannya malam ini, mudah-mudahan bermanfaat dan sampai ketemu besok. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih banyak dokter.